So what we did was a prospective study in pediatric patients who were evaluated in our pediatric preventive cardiology and metabolic clinic at Cleveland Clinic in Ohio. And what we did was compare cardiovascular disease markers between these patients and patients who have familial hypercholesterolemia. And we know that familial hypercholesterolemia patients have a very severely increased risk of cardiovascular disease. These patients are at the highest risk of cardiovascular disease, and they're started on medications as early as their second decade, some within their first decade. So when we evaluated these cardiovascular disease markers between those patients with familial hypercholesterolemia and those patients who were being evaluated for obesity and overweight, we found that while both patient groups had elevated levels of cardiovascular disease markers that were significantly above the normal levels of cutoff, we didn't see any difference between the two groups when we compared these markers of LPA or lipoprotein A, MPO or myeloperoxidase, and HSCRP or high sensitivity C-reactive protein. So what this indicates to us is that our pediatric patients who are overweight or obese have an increased cardiovascular disease risk that's comparable to those patients who have familial hypercholesterolemia. And the message that we hope to get out there is that with those patients who have familial hypercholesterolemia, their management and treatment is much, much more aggressive, and perhaps we should be thinking along similar lines with those patients who are obese or overweight.